Can you get SSDI for psoriatic arthritis? Yes, it is possible, but Social Security will look beyond the diagnosis itself to determine how severely the condition affects your ability to work. Psoriatic arthritis is a chronic inflammatory disease that can cause joint pain, stiffness, swelling, and reduced range of motion. Some people also experience significant fatigue, and symptoms may fluctuate over time, with periods when the condition becomes more severe. The impact on your ability to work can depend on which joints are affected and how severe your symptoms are. If psoriatic arthritis affects your knees, hips, ankles, or feet, you may have difficulty standing or walking for extended periods. If it affects your hands, fingers, wrists, elbows, or shoulders, you may struggle with gripping, reaching, typing, lifting, carrying, or repetitive movements. Pain and fatigue may also affect your ability to maintain a consistent work schedule or sustain activity throughout an 8-hour workday. To qualify for SSDI, you generally need to show that your medically determinable impairment prevents you from engaging in substantial gainful activity and is expected to last at least 12 months or result in death. You must also meet SSDI's work credit requirements. The Social Security Administration will review your medical records and other evidence to determine the severity of your condition. Depending on the specific manifestations of your psoriatic arthritis, SSA may evaluate your impairment under potentially relevant listings, including those involving inflammatory arthritis. However, you do not necessarily have to meet a listing to qualify for SSDI. Many disability claims are decided by evaluating residual functional capacity, or RFC. Your RFC describes the most you can still do in a work setting, despite your limitations. SSA may consider how long you can sit, stand, or walk, how much you can lift or carry, whether you can effectively use your hands and fingers, and whether pain, fatigue, treatment, or medication side effects create additional limitations. Strong medical documentation can be especially important. Treatment notes that consistently document symptoms, physical examination findings, functional difficulties, response to treatment, and ongoing limitations can help SSA understand the full impact of the condition. It is also important to clearly explain how your symptoms affect specific activities, rather than simply stating that you have pain or fatigue. Disability Advocates Group helps people with SSDI claims by reviewing their medical and work history, helping identify evidence that may be important to the claim, and presenting the functional limitations that affect their ability to maintain employment. If psoriatic arthritis has made it impossible for you to continue working, call Disability Advocates Group at 800-788-2095 for a free consultation. You can also use the free SSDI screener on our website to see if you may qualify for Social Security disability benefits. This video provides general information about SSDI. It does not constitute legal advice.